There are 4 million preschool-age students in our country currently that live below the poverty line. There are publicly funded early education programs in place to help these students that are in this low socioeconomic status. But did you know that 60% of the 4-year-olds in our country cannot even access these programs? Policymakers of federal and state governments, you must implement the policy of universal preschool, as every child should have access to and attend early education programs. Today, I will be covering early education as a matter of public health, the socioeconomic gap and limitations that are present in our country, and what the opposition says to this policy. Firstly, early education is in fact a determinant of health over a child's lifetime. According to the CDC, preschool-aged kids are found to have much biological brain development in these years, and that 90% of their adult brain is developed by the age of 6. There are also strong biological effects, strong associations to them, that adverse experiences during these young years are linked with adult diseases such as coronary artery disease, chronic pulmonary disease, and even cancer. Early childhood education also means an improved lifestyle for children. According to the American Public Health Association, kids in preschool are required to be up to date on their immunizations, and this, in part, would mean an increased immunization rates among these children and better health. The APHA also says that preschools are contributors to a lower rate of childhood obesity, as these programs are engaging kids in physical activity, and a lot are providing healthy food and nutrition education. Finally, early childhood education means an improved overall childhood health and development. The National Institute of Health talks about how these program environments are what are fostering the development of not only the brain, but important things such as language ability. The CDC talks about improved cognitive and emotional development and improved self-regulation and improved academic achievement for these students. Now, where we see a gap in achievement is due to socioeconomic gap. And it's this socioeconomic gap that contributes to the lack of access that we see in our country to these publicly funded programs. According to the APHA, more than 60% of 4-year-olds in this country cannot access these programs. And of the preschool age kids that are eligible for these federally subsidized programs, there's only about 30% of them that are actually receiving these services. And there's also not enough spots for a number greater than 3.4 million preschool-aged kids in poverty. And it ultimately is harder to close this educational achievement gap as these students get older and advance through school. Now, compared to other countries, the access to early education programs in our country is very limited. According to the APHA, in 2012, the US was only ranked 35th among other developed economies in preschool enrollment for these 3 to 5-year-olds. There are many countries in Europe that are guaranteeing these kids a minimum of 2 years free for early childhood education. In Denmark, the way that their funding is structured allows for 85% of their preschool-age kids to be enrolled in universal preschool. Now, when looking at the French model, their 3 to 5-year-olds are also guaranteed a spot in an early education program regardless of their socioeconomic status. Now, finally, when we look at the poverty line in our country, this is a huge indicator of this socioeconomic gap. According to the APHA, 1 out of every 4 children, which is 13.5 million of our US preschool kids, they're living below the poverty level. And this poverty level, as recorded in 2011, was about $22,300 as a family income per year. When we look at the average tuition of a preschooler, that's roughly $10,000 per year. This tuition alone is close to 50% of what their family would be earning a year, and at this rate, this is just unfeasible. And I would argue that the way to combat this unfeasibility and make it feasible would be universal preschool. Now, some would argue that during our current political climate and competing fiscal interests, that universal preschool just won't be a priority. Now to that, the APHA talks about the Oklahoma model, in which there have been many recorded benefits of universal preschool. In 1998, Oklahoma enrolled 9,000 preschool students. Now to this date, there are over 40,000 students enrolled in that program. Ultimately, if we increase our advocacy and awareness and talk more about the benefits that programs like that in Oklahoma are succeeding in, then ultimately we can make early childhood education a priority in this country. Now, the other large argument is that universal pre-K is too expensive. Now, the APHA talks about a study in which programming could potentially cost between $11,000 and $15,000 per kid per state. And in a state that's roughly 4 million preschool students, this could be about $50 billion per year. Now, with that being said, with a high quality preschool education, the overall unemployment rates are going to be much lower in our country. And these people that have experienced a high level early education are going to be making $143,000 more than their counterparts that either did not attend an early education program or were in one that was low quality. Further analysis shows that if the U.S. did implement universal pre-K, by the year 2050 there would be $82 billion in budget benefits. Workers would also be compensated an additional $108 billion, and there would be increased health and less crime, which is roughly $115 billion saved. Now, it's these statistics that are showing not only the merit of our early childhood education programs, but the benefit that it would bring our country. Now, today we've covered how early childhood education is a matter of public health, how the socioeconomic gap and limited access of these programs is ever present in our country, and how despite opposition to this policy, it is in fact achievable, and it's already succeeding in states such as Oklahoma. Every child in the U.S., regardless of their socioeconomic status, should have access to and attend an early education program. State and policy federal makers, I implore you to implement universal preschool so that we can narrow the socioeconomic gap and for the health and development of the children that are our future.